Good day everyone. I am Dr. Athira Ramakrishanan. I am an ENT head and neck surgeon. I am also trained in robotic head and neck surgery. I practice in Bangalore. Before I describe ear infection, we need to explain what are the parts of the ear which can get infected. The outer part which is there, it is called the pinna or the external ear. Then there is an ear canal, and the end of the ear canal there is eardrum. So any of these areas can get infected. The infection of the outer ear is called external ear infection. The canal infection is called external otitis. And the infection of the eardrum is called meningitis or the eardrum infection. So usually what happens is many people like to clean the ear with earbuds or older instrument called ear cleaning devices which are traditionally used in India. What happens is when you use these devices, you actually end up causing small cuts in the skin of the ear. And when you pass your hand over that, or if some infectious agents go through the skin, it can cause skin infection of the ear canal or the external ear. The second kind of infection is called middle ear infection, which is due to cold. Infection from the nose or throat can extend into the ear. We have a tube connecting the ear to the nose called the eustachian tube, which actually angulates like this inside the ear, and that can actually allow the infection to spread from the nose and throat to the middle ear. And when the middle ear is infected, there will be a lot of mucus and pus formation in the ear, which may actually get stuck in the ear, and later on it can come out making a hole in the eardrum. This is called a perforation of the eardrum. This happens usually in children when they have recurrent cold and infections, and if you don't treat them in time, they can have burst eardrum, which may allow the pus to come out, but the child will be left with a small hole in the eardrum. In actually the nature itself makes a hole for the pus to come out so that the infection does not spread to the brain or any other part of the body. But to avoid these kind of things, what you have to do is to avoid external ear infection and the canal infection, you should stop using any kinds of earbuds or ear cleaning devices. Our ear has been designed by God to clean it itself. You don't need to actually clean the ear. So normally what happens is people think there is wax formation, I should clean the ear. Actually you don't need to do this. When we talk or chew, the movement of the jawbone causes the ear to wax to come out. Usually what happens is when you put an instrument, you actually drive the wax inside, or you may actually injure your ear canal or eardrum. So you don't need to clean the ear. This will itself prevent a lot of infection. And the second kind of infection, the middle ear infection, if you want to prevent, you should not allow the cold to escalate. If you have a cold infection, take symptomatic medications. If you have a bacterial infection, take antibiotic as per the advice of your doctor.